Joining us today. This is our fourth session for our virtual telehealth conference week. Welcome to the North Country Telehealth Conference. Our theme this year is Uniting the Future of Population Health and Virtual Care. We came up with this theme pre-COVID, so I feel like that future is already here. My name is Katie Cook. I'm the Telehealth Project Manager at Adirondack Health Institute. All sessions this week are brought to you by the North Country Telehealth Partnership, which is a joint effort between AHI and Fort Drum Regional Health Planning Organization since 2015. Today's session is the silver lining, how COVID has removed barriers to telehealth and how virtual care will play a major role in our new normal, which features Andrew Spadoni from MVP Healthcare. We do want to give a sincere thank you to all of our past sponsors. For those who don't know, this is the 6th year of the North Country Telehealth Conference, and it would not be possible without all of the organizations represented on the slide. We're hoping that next year we'll be able to reconvene in person. So a few housekeeping items to discuss. You've all been muted upon entry and your video should be off. Please do not turn it on. No one's line is going to be unmuted during this session, but in terms of your audio experience, please make sure that you've chosen either the computer audio or phone audio. If you have both on, you may hear an echo. For optimal viewing of the slide deck and video, you may want to try side-by-side mode. To activate side-by-side mode, you would click on View Options at the top center of your screen and choose side-by-side mode from that drop-down. Use the Zoom chat function to submit any and all questions for the presenter or AHI staff if you're having technical issues, and we will ensure that your questions get answered. We are holding questions until the end of the presentation today. And of course, we will be sharing the slide deck, and this is being recorded. They will be archived on our website by October 9th. I'm now going to introduce today's speaker. So Andrew Spadoni is the leader of market innovation and ancillary products for MVP Healthcare. In this role, he oversees the product's strategy, implementation, and oversight for MVP Healthcare's telemedicine programs, including the direct-to-consumer apps My Visit Now and My ER Now. He also leads MVP's diversified services product strategy, including HRA, HSA, FSA, and COBRA. I'm now going to turn it over to Andrew.
Thanks for the introduction, Katie. So I'm gonna get my screen up and shared, and we'll be good to go. Just can everyone see the screen? Quick
yes.
Thumbs if it's good.
Yes.
Sounds good. All right, thanks, Katie, and thanks to AHI again for having me. Kind of an exciting topic, a bittersweet topic, but just kind of want to jump in because we only have an hour. And then, like Katie said, we'll take some questions at the end that'll be submitted throughout. So it's obviously been a challenging time for all of us in the healthcare community, from providers to payers to our members and patients. While the last few months have been extremely difficult, there are some silver linings that have come out of the COVID-19 pandemic. I'm going to talk about how the pandemic has necessitated incredible growth in telehealth and how we're positioned as a community going forward. So slides still moving for everybody? Just want to make sure on the first click that everything is good to go.
Yep, you look good.
All right, thanks, Katie. So a little bit of background on who MVP Healthcare is and what we do. I'm sure a lot of you, being in upstate New York, have heard of us. But we're a medium-sized health insurer. We operate in New York State and basically every county north of New York City, as well as the entire state of Vermont. So you can see there serving 76 counties across New York and Vermont. So a pretty big geographic footprint, a pretty diverse geographic footprint, with cities, more rural areas. And then obviously, we navigate two pretty different regulatory environments in New York and Vermont, as well as the federal regulatory environment. So, we can kind of touch on those things later in the deck, but they do present some challenges for telehealth. A little more background about MVP. As many of you probably know, we're headquartered in Schenectady and have offices throughout New York State. Me personally, I work here in Rochester, not in the office right now, obviously, haven't gone back yet. So I'm here in my second, very green, hopefully soon to be painted second bedroom. We serve commercial groups. We serve members through commercial groups, Medicare Advantage, as well as state programs like Medicaid and CHIP. And you can see there, we have about 700,000 members in total, almost 1 million doctors, specialists, and hospitals that we contract with, and about 1,700 employees. So jumping into the content of the silver lining that we're seeing coming out of the pandemic with telehealth, I just wanted to share this quote from our CEO. During the height of the pandemic in New York State, we witnessed 5 to 6 years of healthcare transformation in a matter of 6 weeks. So it was recently shared, like I said, by our CEO, Chris Vecchio. It's pretty apparent that the industry, which was already changing rapidly over the last 10 years, saw a massive acceleration and transformation. I'm thinking back to those first couple days of when we got sent home from work, of when things started to kind of get a little bit crazy, in early to mid-March, in kind of the rapid way in which new strategies were adopted, new strategies were implemented, and they're the type of things that we normally would have taken 12 to 18 months on, and we were doing in 12 to 18 days. So out this presentation, I'll have a few charts that I'll present to show how this is looking retrospectively, but also, looking forward, I certainly expect that progress to continue. Okay, so a little bit of background when we talk about the silver linings that we may realize from this. I think we kind of bucketed it, and it comes down to 3 different things. The first one is provider readiness, how willing and quickly our providers locally were able to be up and running and ready to go. The second one is insurer readiness, the steps that we took as MVP or other insurers in our footprint might have taken, whether it was CDPHP, Excelis, Blue Cross Blue Shield, Northeastern New York, some of the changes that were put in place to be able to go on that front. And then third and final, the one that followed those first 2, are member or patient adoption. I'll go into these 3 as we go through the deck, but those are the 3 things that the pandemic has really driven that are here to stay. So just to level set right now about how MVP does support telehealth, you can see right away we've kind of narrowed it down to covered benefits in the context that we're going to talk about today. So that might exclude those direct-to-consumer platforms for telehealth that you might see advertised, like Roe for men's health, or someone else like Alma who deals in the mental health space. Kind of discounting those for right now. They've obviously had a huge impact and have grown pretty rapidly, during the pandemic. But I wanted to focus really on the 2 main buckets of how MVP supports telehealth adoption. The first one are provider platforms. These are solutions that we support through our provider payment policy and other forms of support. This is far and away our most used telehealth pathway for our members. So if you think about a hospital system who's handling this through sort of a tech-enabled platform, whether it's sort of a telehealth specific one like American Well, or if it's something a little more broad like Microsoft Teams, things like that were allowed when some of the HIPAA regulations were relaxed. That's what we're talking about with provider platforms. And then obviously those are staffed by our local network providers, and it can be in a number of specialties. The other side of that of how MVP supports telehealth is our own platforms. So we do offer a couple different apps that our members can use to access care. This is more intended to be a wrap for when maybe their PCP's office isn't open, or they can't get to an urgent care. Maybe they're out of area, they're traveling, they're on vacation, things like that. This is the other way that we're able to help support our members' adoption of telehealth. The main one here, I have it listed as GIA. This is what Katie mentioned was previously My ER Now. It's undergoing a little bit of a rebrand, but this is really supposed to be our front door. And from there, our members can be referred to in-person care that might be local if it's needed. The second one here that's listed is My Visit Now. This is for more scheduled visits like behavioral health, nutrition, psychiatry, things like that. And then the third one, which we're launching in January this year, is Facera, which is a virtual PT MSK platform that our members will have access to. So I'm going to go through, and as we go through this presentation, I'll cover both of these pathways. But admittedly, the data that I have access to is a little bit better on our own platforms. So there might be a little bit more of a slant there. So just kind of giving you a heads up of what we're going to walk through in level setting what the landscape looks like from the MVP support perspective. So this is a growth chart of our utilization on our owned platforms, going back to when we first launched My Visit Now in January 2017. And it goes up through February of this year. As you can see, we were pretty happy with the growth all along. We were looking at it and kind of patting ourselves on the back with 35 to 40% year-over-year growth. If you compare month to month from the year prior, we were pretty happy with how things were going, and we thought we were doing pretty well. We put a significant marketing effort around it. We worked with our local providers on it, on creating awareness, things like that. So we thought we did a really good job, and that was until, if you zoom out a little bit and look at the next slide, what happened in March 2020. So I think really the main takeaway here is that, all the marketing prowess or the member experience prowess in the world really is no match for the sort of market forces that are out there, and the need for members to find an alternate pathway to care. So as you can see there in the red, it really highlights March 2020 when things really hit the fan sort of and beyond. And you can see really how things have grown since then. In red, obviously, the urgent care exhibited strong growth, especially in March and April, when it was difficult for members to maybe get out of their house and get to an in-office appointment, things like that. And then, even looking into August and in September, I've looked at sort of the projected stats for September. Behavioral health and psychiatry on our platform still continues to be strong. So that really kind of, humbled our feelings that we had up until February 2020, and kind of seeing sort of the member adoption that was necessitated was really, really a good thing to see, seeing how members are ready to pick it up and utilize things. If I go to the next slide, this probably puts things into perspective a little bit more. These are all of our telehealth visits, both through our network providers and through our own platforms. Again, in February 2020, we were feeling pretty good about the work we had done to promote visits on our own platform and the growth we'd seen. You can see here the response, though, that we received from our provider community, to the point now where the last couple months, really since April of 2020, 95% or more of our telehealth visits were done by our network providers on their own platforms. So really what this shows is that, while our own platforms are a great way for members to access care when they can't see their own providers, that PCP relationship, it really does show that members want to see someone who they're familiar with, who they're comfortable with. And I think also, as a testament to the local providers, how quickly they pick things up, and how they were able to really deliver care in a timely manner and be kind of ready to go there in March. So again, overwhelmingly, most of our telehealth visits are done by our local providers, who we're really happy to work with. So that's sort of a little insight into the outcome of what happened from March until August. The next couple slides, I'm going to get into how provider insurer response set up some of that member adoption that we saw in that sneak peek. So this is an overview of the communications. On our side, we had a flurry of information that we sent out to members, groups, and providers. Along the right side here, it's a non-exhaustive list of some of those approaches. The main thing we focused on were maintaining member or patient access and being able to route them to the right place, and also keeping up with the regulatory changes that need to be communicated. I think over the first, probably in my time working in health insurance, there was probably, every 6 to 8 weeks, there was a major change on the regulatory front that we needed to work on to implement and communicate. In early and mid-March up through April, it felt like we were having changes that needed to be communicated and implemented every single day. So that was a huge lift to be able to be up and running and keeping things in compliance. So that was a major part. So just to highlight a couple of the responses and communications that we had. The first major thing was we launched a brand agnostic website. You can see it there on the bottom, trytelemedicinefirst.com. There's a little screen grab there. The public can go on that website and search one of two ways to find a telemedicine resource or solution. So they can either go look for solutions available through their insurer. And again, this is brand agnostic, so it works for those with other insurers, whether it's one of the big national carriers like UHC or CDPHP or Excelis, right down to the local ones. Or they can also search by hospital location. So if you're someone who's comfortable in your hospital system, and you want to kind of find a solution within that framework, we can find something that would be in line for what you're looking for. So again, really, really easy for members to use or patients to use, because they don't necessarily have to be members. It's open to everybody. So if you guys have a chance, I definitely encourage everyone to check it out. Again, very easy to use and we can connect the public with resources very quickly through that website. The second major thing we did during that time was we launched a new MVP-owned platform, My Now, and that's actually a project that we did with one of the previous sponsors that I saw on the slide that Katie shared, United Concierge Medicine, or UCM Digital Health as they're known now. This kind of gave us more of a local connection when we needed that, to allow members basically to be referred or routed for in-person care as needed locally. And it also helped coordinate local testing resources for us as we had to route members to different places. So that sort of more local flair to it allowed for us to be a little bit more responsive and get our members and patients where they needed to be. And again, on the first slide, I kind of buried the lead here a little bit, but this is being rebranded as GIA. And it's going to be more of an all-encompassing telemedicine solution for 2021, where it'll be able to, basically it kind of works to direct members to in-person care where they need to go and help them find the right resources. But it did, while it was branded as My Now, it did help tremendously in the height of the pandemic. I think we kind of identified the need to launch this and had it up and running in just a few weeks. So it was an incredibly quick turnaround, definitely a lot of work in a short amount of time. But I think we had it up. I think we probably decided that we were going to do it in like March 12th, March 13th, and it was up and running, I think by like March 23rd, March 24th. So it was a tough couple days to get that up and running in the App Store and be on our way. But definitely something that our members found tremendous use in. There's tons of uptake on it when it first launched. So another major shift that helped aid member adoption in telehealth was a move to $0 copay for telemedicine services. This is partly in relation to some of the regulatory shifts that we saw, and then partly, kind of solving for some of the member experience things that we were seeing and hearing in the first couple of days of the pandemic. So this change affected almost our entire membership. I say that with the caveat that there are a few sort of self-insured groups, self-funded groups that didn't decide to go down this path. But basically, obviously everyone in Medicaid still had $0 cost share. Almost all of our Medicare membership had $0 cost share. But this also affected all of our commercial groups. So even looking at, members who are in high deductible health plans, things like that, where it was possible to go down to a $0 copay. Really accomplished three big things for us. One, it reduced member uncertainty. If you think about people who have a deductible, things like that, they don't really necessarily know exactly how much things are going to cost when they go to the doctor. So kind of reduce some of that uncertainty. It decreased the financial burden on members, and overall, it really increased the likelihood that members would seek care. And obviously, that was a barrier that we wanted to chip away at when you have a public health pandemic like the one we were seeing. So now that we've covered the insurer readiness, I want to touch on provider readiness. And this is one of my favorite charts. You can see that major inflection point on March 23rd where New York put a pause on elective surgeries. So this chart is claims from our network providers. We did a 3-day rolling claims average to kind of smooth out some of the weekend idiosyncrasies that are in there. And this is for March of 2020. Sorry, I should have clarified that this is just telehealth claims. So you can see there, again, March 23rd, there's a major inflection point, and that's where New York put a pause on elective surgeries. in my mind, this was sort of a bit of a signal point for the public in the shift to telemedicine. Offices weren't necessarily closed as a rule, but a lot of people kind of, were maybe a little bit hesitant to go into offices at that point. And you can see from the chart, if you look at where March 23rd is, probably just a week later, March 30th, March 31st, we're talking 7 or 8 days. And our local providers were up and running at a really decent capacity. So, like I said, just about a week it took everyone to kind of figured out what they needed to do from an operational standpoint, figured out what they needed to do from a technology standpoint, or at least, I'd figure them out enough to make things work and make things run smoothly. And during that time, we talked to a good number of systems to see how we could support them from a technology perspective, what we could do to help. And almost every health system we talked to seemed like they already, they had a solution in mind, or a platform in the works that they were gonna make work for their population and their providers. Additionally, it was reassuring to see the regulatory flexibility around getting providers up and running. I think everyone's aware of the hold that was put on some of the platform HIPAA requirements that made it easier than ever for providers to deliver care in a pretty sensible way. If you think about things like allowing for Teams or FaceTime or Zoom, for visits, I think that really helped to get everyone up and running. And it was amazing to see how prepared providers were for that shift to virtual care. So again, that exceeded, pretty much every expectation that I had, and was really reassuring to see, both in response and going forward. So what were the outcomes of those provider and insurer readiness slides that I just went through? If you look here, this is our overall claims going back to August of 2019 up through the end of July. And we don't have the August numbers for 2020 on here, but this trend has really continued on. If you look at, up through February, practically 0% of our visits pre-pandemic were through telehealth. You can see a lot of them were in office there. And then in March, obviously, the in-office visits kind of tail off a little bit and hit a bottom in April. At the same time, you saw it in the previous slide where provider offices got up and running pretty quickly on telehealth. You can see there the slope start in March and then continue on. But the reassuring thing to see here, I think, is the way that telehealth line is opening, even in light of in-person visits spiking back up to a higher level than they were at pre-pandemic. So you can see here, telehealth visits holding steady at about a third of all visits. Like I said, again, August continued that trend, and it looks like so far in September that this has kept moving in this direction. So, I think it shows a little bit that, providers are realizing that this was a worthwhile way to practice. Members and patients are realizing that it's worthwhile and worth their time. So it is nice to see that even in the face of in-person visits, picking back up and taking a larger chunk of visits, that the telehealth visits have maintained a foothold, at least in our population. So on the behavioral health side, I think this tells the same story as the previous slide, except obviously a little more so. So, same story again, behavioral health, mental health, practically 0% of all of our visits up through February were done through telehealth. And again, as sort of the outpatient physician type visits declined and kind of saw a low there, the behavioral health telehealth visits skyrocketed to the point where they're still climbing in June and July. So right now we're at about 3/4 of all of our behavioral health visits are through telehealth. In August, we saw that continue. It leveled out a little bit, but it still is holding strong. So obviously behavioral health is a really good use case for telehealth. It's one that fits really well. And I think, when we kind of get down into the slides here in the next couple slides about where we think this is going, I think behavioral health really is the sort of victory story of the silver lining that the pandemic kind of necessitated, and how quickly that moved to an online fashion. So here again, this is where I mentioned earlier, I have a little bit better data on our own platforms. This is looking at just My Visit Now, where we do handle some behavioral health scheduled visits. I looked at every unique visitor that we had between March and August of 2020. So all those unique visitors, about 82% of the people that used the service between March and August were using the service for the first time. So 4 of every 5 had never used the service before, which is pretty astounding, getting new people in the door, getting new utilization. And then of those members who used the service for the first time between March and August, they had an average of 4.5 visits each. So they're liking it through telehealth. They're finding it useful. They're using it over and over again. And they also, I don't have it on the slide, but they did score. We asked when members wrap up a visit, we asked them to rate the provider and rate the experience out of 5 stars. And those new users have rated the service very well. And then again, of those new patients, 2/3 of them use the service more than once. So it's definitely been something that's been well adopted and well received. And it's been a really nice value add that people have picked it up during the pandemic. So what comes next? Like I mentioned, I think we'll continue to see growth in behavioral health. I think that's going to be one of the big stories that comes out of this. I think the big thing being really increasing access. Decreasing wait times, things like that, being able to route provider resources sort of where they're needed, being able to see a provider who happens to be 500 miles away instead of in the town next to you. So I think that'll continue to be a big story. The other big thing that I think we'll see a lot of, I think we'll see significant growth in telehealth for the management of chronic conditions. So if you look around the landscape, there are a ton of device companies that are creating connected devices. I think, I don't know if any of you watched the recent Apple keynote speech about their new products, constantly adding features to the Apple Watch. I think now they added like a pulse oximeter in addition to some of the cardiac type measurements that they had before. So I think we're going to continue to see a lot of growth in the wearable space. And then I think, you'll see providers who will make use of that technology to have more efficient touch points. More frequent touch points in managing their patients that have chronic conditions. So I think, especially you'll see this across diabetes, COPD, and other cardiac issues that we'll see, as well as weight management. So in all, very promising growth and adoption in something that I guess the speed of the growth and the acceleration is something that would not really have been possible, I think, without flexibility from everyone. So that's, on the provider side, on the regulatory side, insurers, members. So definitely, I think pretty promising looking forward, and a lot to look forward to. I think it'll be interesting to sort of see what other use cases come out, and where things go. So with that said, I'll turn it back over to Katie, I think, who's curating questions, and we'll go from there.
Thank you, Andrew. I actually have a question. So I like that you shared a lot of data, so I appreciate that. My question is, the data clearly indicates that the preference of your membership is seeing their own providers versus utilizing the direct-to-consumer platform. So has that shifted the strategy on your end to realize that maybe we need to focus a little more on the provider networks instead of the direct-to-consumer app?
Yep. Yeah. I think, I think that's definitely something that we're in the works, and I would caveat everything with saying that we're kind of still figuring things out right now, as we go and kind of have a go forward strategy. I think the big thing is that we're, sort of working around the regulatory restrictions, things like that, before we really develop like a fuller strategy or implement a fuller strategy. But I definitely think that's something that we're considering and thinking about. especially on the primary care side. I think that's something that's important. It's a relationship that's tough to replace. So it's definitely something that we're thinking about, and probably we'll have more information on soon.
All right. So Howard Reese has asked, does MVP Health support claims for teledentistry?
I have to be honest, it's a little bit out of my area of expertise. I can work to grab an answer on that, and get back to him.
Okay. Next question, Melissa Streeter, is there any data related to the rehabilitation realm?
Which type of
That's my question too, Melissa. If you could put in the chat specifically what type of rehabilitation, we'll circle back. Next question, Eileen Martin. Is there data cross-referencing folks with substance use disorder? Are we reaching these folks with telehealth? I think we meaning MVP.
Yeah, and I don't have a ton of data on our network provider side, but I do know that substance abuse is probably our number one most common. We basically, through our intake form, on our own platform, substance abuse is the number one most common discussion topic that we have when someone meets with a therapist or provider. So certainly something that's being reached or brought up commonly. In terms of data around, how many of the people are we reaching, things like that. I think that's something we have a little bit more work to do on. But it's certainly something that's an issue that's brought up quite frequently that we're able to deal with over telehealth.
Okay. Circling back to Melissa, she is referring to outpatient physical therapy and occupational therapy data.
Yep. So on our own platforms, we haven't actually launched Ficera yet. That'll be January 1st. We're working with a partner on that. And for the most part, it's very well received, really strong member satisfaction and patient satisfaction scores. In terms of clinical outcomes, I can get her a little more data on that. I don't want to speak off the cuff on it, but I can get some more data on clinical outcomes for that.
Okay. Next question is from Jessica Bordeaux. What about incarcerated folks? Is there data for telehealth there? Is telehealth even being conducted in that aspect? Human interaction can be crucial for some populations.
Yep, and that's I'm not 100% sure how the system is handling that right now. I know from our own perspective, we don't have a ton of data on it. Certainly something to explore further.
And then the last actual question here so far, now second to last, Lisa Perry, could you explain a little more about how My Visit Now works? Is it a referral platform, or do patients actually receive clinical services? If the latter, who are the providers? Are they network providers or employed by MVP?
Yep, so these are network providers, and I should clarify, there's sort of two different platforms here. The first one, the question was specifically about My Visit Now. They're providers who are network providers, standard network practice, and it's through the American Well Medical Group. So members can get treatment right there on the line from those providers. The other side of that is what was formerly My ER Now, and will now sort of going forward be known as GIA. That is sort of a, I guess when you look at, is it a referral or is it a sort of a treat in place, treat on the line platform? It's a bit of a hybrid of both. So really I guess members, when they do call in, if it's an issue that can be resolved through telehealth, it'll be resolved right there on the line with that provider. If it's not something that can be resolved through telehealth, we work with our partner on that platform to refer to in-person care to our network providers. So, things like labs or radiology might be needed. They might need a physical urgent care, things like that. And I guess beyond just sort of the urgent care issues, if it's something where a cardiologist is needed, they can refer there. So really the goal there is to connect our members with in-network, in-person providers.
Okay. And Dan Shappy, is there comparison data available between in-person and telemedicine/virtual medicine related to cost of care, satisfaction, patient and provider both, and quality/outcomes available in addition to the access data that you shared?
Yep. So taking those one by one, total cost per episode. When we compare telehealth to office to urgent care to ER, that's sort of, I guess, spectrum of sites of service or intensity of service. We have found that telehealth, when, all encompassing, when you look at the initial visit, whether there's a prescription written, if there's any follow-up care needed, we have found that telehealth does come out a little more cost effective.
Excellent.
It's pretty comparable to an office visit, and then obviously when you go to the emergency department, things like that, it's much more effective. In terms of patient satisfaction and things like that, I don't have data right in front of me on in-person care. I do know for our own platforms, when we do ask them to rate each visit, out of 5 stars, how was your experience? How was the provider? I think about 97% of people rate their provider 4 or 5 stars out of 5. I think it was like 94% of people rate the experience 4 or 5 stars out of 5. So they are pretty happy with it. We have it's a pretty low percentage of 1-star reviews.
Okay.
Yeah.
No other questions have come through. So thank you, Andrew. I think we'll wrap it up at this point. I will connect you to a few of the folks who answered questions looking for a little more data, so you can follow up with them one-on-one. That wraps up this afternoon's session. Andrew, did you have any closing thoughts?
Nope. Just thanks for the good conversation, and thank you, Katie and AHI, for having me, and thanks to all the sponsors.
So tomorrow's sessions, we have our Telehealth Innovator Award ceremony at 10 a.m. And then our kind of highlight panel tomorrow afternoon at 2 o'clock. From 2 to 4, we have our New York State Agency Telehealth panel. So you will have the Department of Health, Office of Mental Health, and Office of Addiction Services and Supports. It's a 7-member panel that's running from 2 to 4 p.m. tomorrow. We are approaching the limit for registration on that. So if you have not yet registered for that session, that is certainly one you will want to listen into. So until tomorrow, thank you for attending our second virtual day of the Telehealth Conference Week, and we will see you tomorrow.